three main takeaways I want you to focus in on is one, meet people where they are, cultivate excellence, and always, always, always pay it forward.
Hello, everybody. Thank you all for coming on tonight. I'm Dr. Kelly O. Elmore. I am a board certified OBGYN and a healthcare executive. We are here to help you live your healthiest and wealthiest life. And the way that we do that is through our program. It's called Viva Life 5, where we focus on your 5 pillars: spiritual, physical, financial, mental, and emotional. And we do 5 things. We meditate, journal, exercise, optimize our hormones, nutrition, and our sleep. Also, we offer you webinars like this one tonight, podcasts, which comes on 3 times a week, as well as something we call an affirmation room and our Viva Life experiences. But enough about Dr. Kelly OMD. Tonight is about Andrea Petrovani-Green. Excuse me, allow me to say President Andrea Petrovani-Green. She is a friend, a colleague. She's been my mentor. She's been my advocate and a sponsor. She's going to tell you a little bit about herself and the top 3 things she wants you to take away tonight. Andrea, the floor is yours.
Thank you, thank you. And aloha, everyone, coming in from, of course, Hawaii. Again, talking about what we're going to discuss tonight, 3 main takeaways I want you to focus in on is one, meet people where they are. Meet people where they are. Cultivate excellence. There's no such thing as perfection. We want to cultivate excellence and always, always, always pay it forward. A little bit about myself.
Yes, please tell us about you, because we love your history, your career, so many things that you have done. And the reason why many of us are on here is because you have affected each one of our lives.
Yeah, so just born and raised in Trinidad and Tobago, and was raised by my grandmother. And so I had a beginning where I was influenced by, you know, older and wiser. So I think wisdom was a big part of what I was exposed to, which has helped me later on in my life and career. But once I immigrated to the United States and started high school, I decided that I wanted to help others. And I was like, what can I do? How can I figure out what I want to do when I grow up? So I volunteered as a candy striper, lived in Staten Island at St. Vincent's Medical Center. And that started my nursing journey. I would say that I had great experiences with the nurses. So that myth about nurses eating their young, thankfully, I did not have that. I have nurses who was eager to help me, take me under their wing, and kind of show me the ropes. And so they knew I was interested and always call for me in the call room. Hey, send Andrea up. We have something interesting going on here. And that's when I started a passion for the elderly and gerontology. And so at about 16, I was like, I want to be a gerontological nurse. I love the elderly. I have a passion for it. And at the end of the day, once I realized that my high school had a practical nursing program, I decided this is what I want to do. So I signed up. I went and, told my counselor, my guidance counselor, I'm interested in going to the nursing program. I was at the time in advanced placement classes. So my teachers were not too happy that I wanted to switch and interested in nursing. They wanted me to stay, but that they were fine. And so I started that journey. And, several months, and when I was eligible to sit for the CNA exam, I became a certified nursing assistant. And from that point, I worked at a nursing home for about 4 to 5 years, all the way through undergrad, which I loved. And also did visiting nursing. One of the nurses like, hey, we have some, patients that I think you'll be interested in doing home visits on the weekend. So I did that as well. But yeah, that moved my journey from, nothing I really planned. Things just kind of fell into place. And I always had people around me who were always wanting to help me to that next level. And I've been always very grateful for that. And that's why I focus on paying it forward, because without them, I wouldn't be here today. I would be sitting talking about my journey. And the rest of it is in undergrad, I received a Navy scholarship and started another journey as a Navy nurse in 1993 and served 30 years, retired a few years ago. And Kelly and I met. We met gosh, forget exact points where we met up in a career, but it's been a while. But mentorship has paved the way, and I feel that that is the bedrock, that is the foundation of what we should be doing to taking care, especially, sometimes we are it's easy to pick the folks who rise to the top.
Mm.
I always look for the diamond in the rough, that person that's there that has that talent, has that ability, but just needs a little bit of massaging, just needs some time spent, some positive energy, and that can turn a life around completely. And I've seen it and experienced it. So that is truly something I'm passionate about. I love more of a one-on-one and small groups. To be more effective as far as communication and understanding and having an opportunity to ask questions and share stories. I think the biggest thing is we have to really get better about sharing our stories. That inspires more people. People are always watching, always paying attention. I think a lot of times, and I spoke about this recently in my president's message, we look at people and it's almost intimidating to approach because, they're like all these letters and they're the VP or the president or what have you. And behind that, it's a real person. Behind that, it's those titles and those credentials, a real person with a story, and that story can make a difference in changing somebody's lives for the better. So I always try to push that as far as tell your story.
Yeah, and there's one thing about you, Andrea, is you have wonderful stories. And so that's why I'm going to back it up a little bit because you gave us, from the beginning to where you are now. And I know people have a lot of questions like about the times in the middle. I do want to say, Andrea, as many of you know, Viva Life is based on the life of living your healthiest and wealthiest life. And I got inspired by my mother. She showed me how to do all of this. So now my mother's 86. She has her own diagnoses. And Andrea contacts me almost every single week and says, "How is mom doing?" So just going back from being that candy striper and realizing that the wisdom really is in the room, right? No matter what the age is, the wisdom is in the room. How did those candy striper days and that wise counsel help you as you moved along in your life and your career?
Yeah, I think the big thing I always try to put in perspective is to remember where you came from. And so those early days of where a little high schooler trying to find my way through life and dealing with a lot of changes. I mean, I moved and immigrated from Trinidad. There was a lot of change in, of course, the culture, the history, having to get that. But then again, having an opportunity to share who I am and more importantly, listen. I feel we have lost that art of really listening. And so I spent a lot of time and focus now on my journaling is to take some time to listen to it, not just to respond, but truly, truly listen. And I learned a lot just about people's story and their life. And they're like, "You remember that?" And I was like, "Yeah." They're like, "Oh, you were paying attention." Or even if it's a small detail you take away, you're like, "Wow, I didn't realize you were paying attention to that." So listening is key. I think is the key for leaders. We have a tendency in this world that we're in. Everything is just so fast paced. There's so much noise. There's so much going on around us. There's so much distraction. And going back to those days, we didn't have that noise. We didn't have that distraction. So a lot of time we were spent in the call room and we would have these really deep conversations about life. What do you want to do? Sometimes a little bit too deep for a 15, 16-year-old because I had no idea. I had no idea, but I listened. And to stay humble. Some people, again, I always remind people, you're for nursing, you always are RN or LPN. I started off as an LPN as well. And to never forget where you came from in that respect, because no matter how many degrees and how much you accomplish, you know, humility will take you further in life. And some people's like, "Well, how do some people respond to you in a certain way?" And I said, I remember that at the end of the day, we're all humans and just living this life and trying to figure things out as we go.
And that is, I mean, that is so true. That is something that I was just having this conversation with my 12-year-old. It's how you make people feel, it's
Francis.
how you treat people. Exactly.
Yeah.
When we talk about respect, is respect can be mutual no matter what age you are. It's the how and the feeling that comes along with that. And you're talking about listening, like you said, it's a lost art in many ways because we're always
Yeah.
responding and reacting. But it's like, you know what? Let's take a step back and let's take a breath. And you mentioned something, you mentioned journaling. And I know you're a
Yes.
runner too. So tell me
Yes.
how over your career professionally and personally have you placed those types of things in your life so that you could, last as not just last as long as you have, but been so successful as you truly are now.
Yeah. So a personal story I'll share, and I don't mind being vulnerable. My run-in started when I was going through a divorce.
Mm,
And it was my time to be with myself and try to, focus on the present, what was going on, because it's easy to get caught up in all the pain and all the things that comes with that almost losing. It's like a death, right? And at least that's how I felt. And so running, I was stationed actually at the Naval Academy,
mm,
and everybody runs there.
everybody.
So that helped. That helped propel. I started walking, and then once I started running, I really caught the bug, as people will say. They're like, "Did you catch a bug?" And for me, and just to amplify it, it was mental health. It was my mental health, and I didn't know it at the time. I didn't coin it that, but I knew how it made me feel in terms of after I ran and had an opportunity to kind of decompress. Journaling, I've done. I can't even remember. I've always journaled. I feel like, again, taking an opportunity just to write things on paper was very effective because I can always go back and, certain time and look and say, oh, yeah, that's what happened. It helps jog my memory. Again, it's helped, especially today with all of the noise, to kind of sit down and journal and take a couple of deep breaths and say, gosh, another day accomplished, and focus on that here and now. But the running piece also took me to St. Jude when I was stationed in Millington, Tennessee. And my I used to always donate, but my exposure when I wanted to volunteer, and I'll be honest, it was heavy. It was a heavy to see these little kids, with terminal cancers and different diseases. And I went to the coordinator and I said, I can't do this. It's just too heavy for me to go home and take this home with me. And I carry a lot. I'm a feeler. That's my natural thing. So I was taking everything in, and it just wasn't healthy. So
Mm.
I did ask, do you have something else I can participate? They're like, we actually have a St. Jude marathon weekend, and you can certainly help in any facet you want. I was like, sounds like a plan. And it's been about 25 years. Last maybe 20, I've been in the St. Jude's Hero Program. And it also has been a humbling experience because every time I fly into Memphis and have an opportunity to meet the kids, it grounds you.
Mm.
It grounds you like this is real life. What really matters in life when these little tiny kids who are so precious and doesn't know any better teaches you more of a lesson. The mentorship piece is critical because I was talking to a lot of the nurses there, and but also that human piece that you can never replace. Yeah.
I think, that what you're saying is so important. So I wanted to just tag on or ask those questions about how many people in the room, and I know people are driving, listening, and doing all types of things. They're probably doing some type of nursing or nursing admin or entrepreneurship right now, but they're here. They're here for us. But what are some of the things, and audience, you can answer for this for us as well. What are some of the things that you do to ground yourself, to bring yourself back to, peace, whether that's meditation, it's journaling, it's exercise? We need to understand this because you're on the front lines. Nurses are on the front lines. And let me not miss this opportunity to say happy Nursing Week. The reason Nurses Week, absolutely. The reason why we specifically chose this day was that so that Andrea could open this conversation up for us, and bring us into this week with positivity, seeing somebody that's been very successful in the career, but is also vulnerable enough to say, you know what, when I was at my hard times, this is what I did to address burnout or address frustration and anger. So I think this is really important for us. So Andrea already talked about being a runner, as well as holding the babies or holding the hands of senior adults, which releases oxytocin and helps people out a lot. But I just wanted to make sure that people put into place, what are you doing to help yourself to prevent the burnout, to address the stress, the frustration, and anxiety? And Andrea, what do you want to share even further with our audience about that and how important it is to be able to address those situations?
Yeah, so I want to take an opportunity to just share three priorities as president of the American Academy of Ambulatory Care Nursing. I'm a back to the basics type of person. Again, there's so much noise going on all the time. It's like, okay, what did we miss? Let's take a reset. Let's take a pause. Let's go back to the basics and do a pulse check. And one big thing I always focus on is, and we know this very well, is wellness. You have to be well. You have to take care of yourself. You can't take care of anybody else. You're not good for anyone else if you're, not obviously caring for yourself. And those signs are always there. We know when we start feeling stress and the tension and I say, what do you do? So a lot of people who know me and know me well know I am very big on self-care, and I make the time. It's not an excuse to say I don't have the time. You make the time for yourself. That's important. That's critical because again, moving forward, taking care of yourself is should be your priority and setting that. Now, once you're taking care of yourself and you're healthy and well in all aspects, again, day-to-day challenges, mentorship comes in. Now you can take care of others. Right. So that's what I look at as a stepping stone. Take care of yourself. Mentorship, let's take care of others. Let's take care of the future. I always tell people, we have to reach back and pull people forward and, give them that time where we are planning and preparing for the future. And the future is bright. The future is very bright. We always have to make sure we keep that focus on what's important and what matters most. And then volunteerism. I mean, volunteerism is critical. Once you again take care of yourself and you take care of your people, take care of your community, take care of your organization, take care of your association. It's not about you. It's what you give back. As Kennedy and President Kennedy used to say, it's not what you can do your country can do for you is what you can do for your country. So replace it as not whatever organization can do for you is what you can do for the organization. But volunteerism, you'll find out, it's such a big satisfier. I mean, it's an opportunity to give back. It makes you feel good. It helps others in need. It showcases the fact that we're all in this together, and it diminishes those walls of selfishness. So it's about me. It's about really the people that you help along the way, your legacy, the fact that you are contributing to society in a positive way. So wellness, and I coined it nurse wellness, of course, for the American Academy of Ambulatory Care, but wellness overall, mentorship, bring people along, take the time. Sometimes, again, I will mention some people are not the easiest. It might be a little time. You might have to take a pause. You might have to do a warm handoff. Hey, I think this person is going to be great for you because again, someone asked me about being a CRNA. I said, I have no idea, but I know CRNAs. Let me put you in contact with a CRNA so they can tell you what the life is going to be, living that life. And the volunteerism in all aspects. We recently had some really bad storms here in Hawaii, and it was very destructive. And there's a lot of displacement taken. So when I have an opportunity, I love animals, I love dogs. So I would go to the shelter and help out, help promote adoption and just overall anywhere you can. And it doesn't have to be money. We know it's a tough economic times, but it's your time. And time is the most precious commodity, but giving back your time, I think it's priceless. So those are the three things I talked about. And it's near and dear to my heart because I feel synergistically wellness, mentorship, volunteerism really impacts your overall well-being. We
And I
have
think
those things in balance.
for sure. And I think that people think, oh my goodness, I got to do this, I got to do this, I got to do this. But there is a way to be in alignment with all of those things. Like you said, if
Yes.
you're volunteering, it could be you're volunteering and you're going, I don't know, skating, running, Zumbing, whatever the case may be. You're helping with the class, putting it together, whatever the case may be. Or it could be a fundraiser that's associated with it. Well, somebody there is going to recognize you, or maybe you're going to talk to somebody that you didn't know. That's your mentorship right there. Having that conversation is that mentorship. And then the other
Yes.
thing, the self-care is there because if you love doing whatever you just decided to sign up for, then there you go. I mean, I love Zumbing. The first marathon I actually ran was because of Andrea Petrovani-Green. And I'll be honest with you, I'm going to even take it back further. One of the people that helped me start running is Medisa. She's out in, where is she now? She's in Japan.
Japan.
Helped me
Yeah.
start like really running for real, so that I could prepare myself for the next 5 years. And then when you were like, you know what, we're going to do this marathon. And I'm like, yeah, so I'm going to do the 10K and I'll see y'all, when you're done. And you're like, no, you're going to do the marathon and I'll see you when you're done. And I tell you, when I got to mile 18, I thought I was not going to be able to finish. And I saw, APG ran right past me. And I said, well, I'm just going to have to catch up and keep up with her. So thank you so much
Yes.
for encouraging so many of us to align our values, align what we love to do or want to do, and see ourselves as being successful at every step that we want to achieve. So I just had to give you
Yeah.
that shout out, APG. I know a lot of people are on here and they
Thank
started
you.
doing something because of you.
And I'm laughing because I'm seeing someone and always like, hey, let's go for a little run. And, it could be, but it was also an opportunity to mentor, have
Yes.
those conversations and be in that space. And again, it doesn't always have to be this, organized, like, no, it can just be out there having a conversation, walking, running, and just talking about life in general. Hey, what do you want to do? Where do you see yourself? So what are you doing about it? Tell me more. Self-care is not selfish. Yes, Tatiana. But I also want to mention a little bit about the volunteering because I had an opportunity recently. So Roxanne Johnson, she's on the call, Hermerstein Johnson. And probably about 3 years ago, she shared with me her program. She's from Guyana and she has a nonprofit and Blueprint. And she is amazing young lady, can be my daughter. As people always say, is that your daughter? I'm like, yeah, that's my daughter, age-wise. But she has really showed me, I've learned so much from Roxanne in terms of how she navigates life. Another, wisdom in terms and connection. She's a connector. She listens. We do a lot of mentoring session. We reach out to each other. She helps me. She mentors me. So it's a two-way street. Hey, Roxy, I don't know this, but you're that generation. Show me, tell me how we can do this. So again, it doesn't have to be, a more senior person or an older person. Young people have a lot of wisdom and a lot to share. And I really learned that. I honed in on that in Okinawa when my commanding officer, Admiral retired Swap, asked me about, yes, love Admiral Swap. And we had a project to do. And she said, Andrea, you can figure it out. And again, I looked at the people and I said, there's a lot of talent around here. We don't tap into our talent, that whole talent management. It's that little enlisted person sitting in the corner entering data into the computer all day. And I was like, hey, what do you like to do? Tell me more about yourself. And I had 6 clinics all over the island of Okinawa. So it was sometimes an hour and a half to travel to get to the clinic. But I
Mm.
tell this story because this young lady was just a shy introvert. She didn't, just doing her job. And I asked her, I said, hey, I want to bring you in this fold. Tell me some ideas you have. We have this really bad traffic situation with the Marines coming to clinic. It's a mess. They don't know where to go. They don't know where they're supposed to be. There's no directions. Long story short, this young lady received a Navy Commendation Medal because she figured out a way how to design the clinic in a way that was Marine proof, young people proof. It's a lot of young folks that are coming in. And she made like little yellow brick roads in different colors. And this one goes, it didn't seem so simple, but guess what? When I went back to the clinic and that was in motion, I tell you, it was just like, you went to the clinic, it's like, no more sweaty Marines sitting all over, confused and lost. This is where you go to lab, follow the green line. It seems so simple, so impactful, so effective. And I did not take the credit. I told Admiral Swap, not me. I don't want to do it. I said, but this young lady from that point on, she has shined and blossomed and she's a rock star and doing great things. So that's how impactful mentorship, paying attention, listening, and really not always looking for the easy people, but the ones who may seem like, again, maybe a diamond in the rough, or they're just kind of sitting out. They're the introverts who are usually they wait to say something, and then time's up, and they might miss that opportunity. So reach out and know your talent, know your people, know your talent. Because you know what? My success in the military, and of course, I'm being able to mentor, is other people who have helped uplift me, but more importantly, they worked for me. Once they know you're take care of your people and they will take care of you. That's a fact. It
That's
wasn't me.
That is such a great story, and that is so true. And I love what you just said there. You know, when we talk about when we're on this show, we always want to give people solutions, gold nuggets, action items. Basically, look around the room and see who's not there and bring them in the room, right? Also, look around the room and see who's not talking and see what they have to say. And then also invite them from the outside aisle or around the room actually to the table, because that's what we're there for. We have to find our replacements. And when we
Yes.
look for the talent and when we help cultivate the talent, they're going to do what we've been able to do and even more, because they have been poured into. And I think that goes back to your statements, people have the myth of nurses eat their young. And I will tell you, and you have said that many of my mentors have been nurses and they did not eat me up except for to love me up and to pour straight into me. So me being here with you today is a gratitude. Yes, happy Nurses Week. It's a gratitude statement to you for all you've done, and all of my nurses everywhere who have ever taken time to be there for me, as well as our patients, and advocating for our patients on so many different levels. I know we have about 5 minutes left. If anybody had any questions they wanted to ask, this is the time that you can ask the questions. Be gentle with us. And
yes.
if people are too nervous to come off of mute and ask the question, then I want to kind of put it out there. I know we have a lot of nurse executives, okay? Nurse administrative executives. What information do you have for them that you want to leave with them? I know there's some new projects that are coming up that that people are working on, so that can help them in their administrative and entrepreneurial endeavors.
Yeah, great question. The beauty of nursing is that we can be every, and it is so much in terms of your talents and where you can shift that talent or that love, that passion, right? It's all about passion. When it comes to a certain time in life, it's like, what are you passionate about? And so you take these different, avenues. But what I'd like to say is nurse executive. I learned so much. I've learned so much. So I want to give a big shout out, props to the American Academy of Ambulatory Care and Nursing. Board of directors. I see some folks are on currently on. So thank you so much for your support. Learning so much from my colleagues, but more importantly, what it takes, right? Everything's a process, and how do you get there? And that's the mentorship piece. So bringing it back into the fold of mentorship, and why mentorship matters is that there's somebody out there that knows, who's done it. So the entrepreneur piece in terms of where nurses are going, in terms of building ourselves. So I'll mention quickly, we're doing some great initiatives. One is looking at nurse reimbursement. So our past president, she is looking at how do we get nurses for the work that we do to be reimbursed. And we know we are very impactful, especially when it comes to care coordination or care management. With every, healthcare is shifting big time. It's going all outpatient. We know that. I mean, you have surgery today and you're kicked out tomorrow.
We're talking about tonight.
Tonight. and so where does that leave? Nurses that come into play and said, hey, we can do home visits. Kelly, you do remote patient monitoring. Right. And that's all outpatient. If you're not, as past president, immediate past president, Cynthia Murray, she said, hey, if you're in your bed, oh, it's not in the forward. That's ambulatory care. And sometimes it's hard to put into words, but it's everything and anything outpatient that a patient has an encounter with. But the care coordination piece, we are going to be starting up our podcasts. And we're specifically going to start out with care coordination because we know that's impactful for where we are today. And it's only going to get bigger, and it's exploding because we just have so much need, the cost of healthcare, and then shifting that back to you as far as this is where we bring people and said, this is where you need to be. This is where the sausage is being made in healthcare.
Now, you just said like 5 bars there. She dropped gold nuggets all through over this thing. So she just gave you the direction. Entrepreneurs, as well as administrators, nurse executives, we're asking you, number one, to go to the website for AAACN.org, correct? I think I put it in
correct.
there. Mm-hmm. And if you haven't already become a member, you need to be a member. This is your new president.
Yes.
This is your
and
new
we're
president.
in New Orleans next year with both ends of the jazz festival taking place. So if that's a little carrot, come on and join us.
Wonderful. And then we've also dropped the information about the Blueprint Foundation, which is a volunteer effort that is going on in Guyana.
Medical mission.
Also medical mission. And then also I've put the information in there for myself, drkellyomd.com. We talked about the remote patient monitoring and how we're going to be at the cross section of perinatal and perimenopausal/menopausal health. So we are closing the gap. Okay. We are closing the gap from your home to your provider, clinician, hospital. And just to let everybody know, none of us are, representing, except for one, anything else but themselves here. So all the disclaimers have to be said, but we just wanted to make sure that everybody knew that we truly appreciate you being here. And Andrea, how do people get in touch with you on LinkedIn? if they want to
Yes.
follow you?
Andrea Petrovani-Green. I'm easy to find with that Petrovani last name. That's why I kept it. And I'm also on Instagram as well as Facebook. And allow me a little time. Sometimes it is overwhelming, and I do pause to stay in the present and reflect. So if I don't get in contact with you right away, please send me a little reminder. But I'm always happy to introduce and have some connections and real conversations and taking us to the next level. And again, I want to say Happy Nurses Week as we kick off May 6th to May 12th. And one other plug, I know we're over time. I was just invited for an opportunity to go to Ghana to help with a hospital and outpatient there. So I'll be going to Ghana probably early part of next year with one of my mentees, Victoria Eddy, who's from Ghana and has asked me to come and help her cousin set up and coordinate. So again, the blessings keep coming and I appreciate it. I said, be authentic, be your real self, and it will always come back to you tenfold, hundredfold. So thank you for this time, Dr. Kelly
And let me
Elmore.
just put that tap and so it is on that. We touch and agree with you that your presidency is going to be magnificent, magnanimous, and positively impactful, not only for the United States nurses, but people around the globe. And we thank you for that. I'm Dr. Kelly OMD. We're going to be signing off here. Please follow us on all of our social media platforms. You already got the email in the mail because you registered. We look forward to seeing you on Monday evenings and as well as our Viva Life experience. Viva Life.
Viva Life. Thank you. Mahalo.
Mahalo. All right. Thank you for being a part of the Viva Life experience. I'm Dr. Kelly MD, board certified OBGYN and healthcare executive. If you like what you heard, then please go ahead and like, share, and subscribe. The reason why is because we are trying to educate, encourage, and inspire 1 million people to live their healthiest and wealthiest life. And this is what we're bringing you. We're bringing you educational videos. We're bringing you podcasts. We are bringing you webinars with subject matter experts, including myself, about the topics that affect you the most. So go ahead, like, subscribe, and share. We are everywhere. Have a wonderful day. Viva Life.